Good morning, and thank you for sticking with us. My name is Lande Ajose, and I'm the Vice President and Walter and Esther Hewlett Chair in Understanding California's Future and a Senior Fellow with PPIC. Thanks for joining us today. PPIC is pleased to present this program featuring a discussion with California policy leaders on the impact that 2 years of living in the pandemic has had on the mental health of our youth. Before we jump into our program, I have a few housekeeping items. First, today's event is a part of the 2022 PPIC Speaker Series on California's future. As a public charity, PPIC does not take or support positions on any ballot measure or legislation, nor does it support, endorse, or oppose any political parties or candidates for public office. We'd very much like to thank our sponsors of this series for their underwriting support. Those organizations can be seen on your screen and are also listed on our website. The series is also funded by the PPIC Donor Circle and the PPIC Corporate Circle, groups of individuals and organizations that provide generous support to PPIC. I hope you'll consider making a donation so that we can continue to make programs like this possible and ensure that they're free to attend. More information is certainly found on our website at ppic.org. And finally, before we begin, if you have a question for our panelists, please send an email to the email address on your screen. That is ppiceventquestions@gmail.com. We hope you'll include your name and your organization along with your question, and we've set aside 15 minutes at the end of our program to answer those questions. And now, without further ado, I'd like to welcome our distinguished panelists. Their bios can be found on the PPIC event page. So in the interest of time, I'll only provide very brief introductions now. First, we have Alberto Carvalho, the new superintendent of the Los Angeles Unified School District. Superintendent Carvalho, thank you so much for joining us. Next, we have Lishaun Francis, the Director of Behavioral Health at Children Now, a youth policy and advocacy organization. Lishaun, welcome.
Thank you.
And finally, join me in welcoming Melissa Stafford Jones, the Director of the Children and Youth Behavioral Health Initiative at the state's Health and Human Services Agency. Melissa, thanks for being with us.
Good morning.
Thanks so much to all of you for joining us today and for engaging around this really critically important discussion about how we can support our youth and their mental health. You know, I want to start by thinking about this somewhat historically, I guess. You know, I know that youth mental health really worsened even prior to the pandemic. And COVID really seemed to just intensify a lot of the stressors that were already out there. You know, students were experiencing an unimaginable loss of life. They were dealing with the social isolation of not being in school. Many of them were dealing with the economic hardship of not having families who were working, all kinds of other things as well. I'm wondering if you could speak to, and anyone who would like to go first, what COVID has taught us about youth mental health and how we need to address the students' needs around youth mental health. Should we start with you, Mr. Superintendent?
Certainly. Good morning, everyone. Thank you so much for the opportunity. Obviously, I think we need to be real and honest in recognizing that adolescent mental health had actually worsened even in the years prior to the pandemic. However, there was some degree of behind the scenes, behind the curtain approach to addressing, first recognizing mental health issues that young people were suffering from. COVID, however, has brought it to the forefront with a full range of now well understood stressors. The incredible, unimaginable loss of life, social isolation, economic hardship for many households, as well as other stressors. What the pandemic has taught us also about mental health, what the needs are and how we can actually address them. So the issue of prevention is very real and clear to us. The pandemic has actually taught us the importance of recognizing signs, of understanding the adversities that students are actually facing today in more unpredictable ways than ever before. We need to consider ways by which we strengthen the resilience skills of students, equipping students with ways to negotiate through the adversities that they're facing. One way we're doing this in LA is through our trauma and resilience informed early enrichment program, which brings psychiatric social workers into education centers to provide trauma and informed prevention services to particularly our earliest learners. In addition to that, I think that there are current technologies that allow us to do this in more effective ways, whether it is through telehealth connections, through direct contact lines for both students and parents, the ability to partner with community agencies, providing support to students and their families beyond the last bell of school, to address, obviously, the biggest concerns amongst us. Anxiety, challenges adjusting to the in-person setting now that all students are back in school, sort of this re-socialization need for our student community, social and interpersonal issues, depression, coping with the loss of loved ones and the illness of many others. And I think one of the biggest learnings is that mental health and mental well-being is not just the responsibility of a teacher, of a principal. It is actually everyone's business, everyone's responsibility, shared responsibility for the realities currently facing young people in our communities and certainly young people in our schools.
That's great. I see Lishaun and Melissa nodding their heads. Would you guys like to take a crack at responding to that question?
Yeah, I really appreciate the superintendent's response and your comment, Lande. And we know the data bears out what you both described, right? We know that we have seen increasing mental health needs and challenges for children and youth over the last decade plus, but that they were exacerbated during the pandemic. For example, the California Department of Public Health tracked a 20% increase in youth suicide between 2019 and 2020. So, we know these issues were already happening, but they have been exacerbated. We also saw Project Calwell did a survey of youth last school year and saw that about a third of 7th and 9th graders and almost half of 11th graders reported chronic sadness. So I think, though, what we've learned from COVID and maybe where some of the opportunities are is the awareness about how central mental health and social emotional well-being are to the thriving of our children and youth and families is just front and center. And so I think us even having this time together, this session together, this conversation is a testament to that and to the work that we are all doing to really, to the superintendent's point, all of us together, all of society, all of us really focusing on this issue of social emotional well-being and behavioral health for our children and youth. And I just want to share, I've had the opportunity the last couple of months to talk to a number of youth. And just a couple of weeks ago, I was on the phone with 2 high school youth who are very involved in mental health advocacy. And this is one of my takeaways, I think, from the pandemic and for our work now and ahead, which is they said, even though we have been back at school all year, for ourselves and for our peers, we still often feel isolated and lonely, and connecting again with peers and sort of that human connection is challenging. And we need support and really intentional ways that is being supported and assisted for our youth. And so I think sort of this refocusing on human connection for our children and youth is just incredibly important that we take it forward, not just right now as sort of we're in this stage of the pandemic, but long-term going forward.
Thank you. Lishaun, what have we learned around the pandemic and how to respond to student mental health crises?
I think that what happened was we have become simply more aware. It's more in our faces at this point. My concern with all of this is I am really trying to make sure that we're not just learning in the moment, meaning we're not just responding to the current emergency or the current crisis, but really investing in and thinking through prevention. And the reality is much of our conversation around student mental health, a lot of us are talking about it because we see what's happening with 12-year-olds, with 16-year-olds, with 17-year-olds. And prevention really does start at 0. So really thinking through how California is creating a system that supports parents parents and caregivers to support young children, infants and toddlers, because they do become adolescents. And most of the time, the things that we want to see from adolescents are skills that we have to start very early in order to instill in them, and coping mechanisms that have to start early. And very early is what I mean. So I think that we've learned that our foundation was poor. I am concerned that we haven't truly figured out yet that we really do need to start at zero. We really do need to support parents and caregivers going forward so that adolescent mental health can thrive.
You know, I'm really curious about that, because it seems to me that before the pandemic, a lot of what we talked about in terms of the things that were affecting student mental health was social media, or, you know, the more sophisticated conversation, people would talk about ACEs, you know, adverse childhood effects. Is that still the center of the conversation today, or has something fundamentally shifted as a result of the pandemic that we're talking about as we think about how to address student mental health?
So that is part of the conversation. I think everyone here knows that that's still part of the conversation, and it's an important part of the conversation. We can't ignore the role social media is playing on the brains of teens. I mean, everyone heard about the study that even certain groups were doing to really investigate the impact of social media on teens, particularly teen girls, and the results were not positive, right? So we know that these things are happening. On the flip side, though, I do think that a lot of parents have been much more vocal about their need for support, right? Parents are saying, we actually don't know what those signs are, particularly for teens, because as we all know, teens can be moody just naturally. And it is sometimes unclear what is genuinely a problem versus a mental health issue. And parents do need support on what that looks like. The other thing, though, is parents are more stressed these days. So even before the pandemic, right? 1 in 4 birthing parents reported 2 or more ACEs in their own childhood. 1 in 5 mothers experienced depression. So you have a system that's set up where over a third of kids entering foster care are under the age of 3. Half of all kids who die from abuse and neglect are under the age of 1, and 75% are under the age of 3. So what that means is that we have a foundation, we're starting off poorly with young kids. It's no secret that we're going to see this crop up in adolescent mental health if we're not starting early and often.
That's great. Superintendent Carvalho, you know, Lishaun has been talking about some of the distinctions between how young children experience mental health challenges compared with adolescents. Can you talk about how you're experiencing that, how you're witnessing that, and how you're responding within LAUSD? Because you have that whole range of students, both at the very young age, incoming students, kindergartners, and also high school students.
And look, I think that the interactions are key, right? And we spend a lot of time at this point focusing on the trauma, the manifestation of behaviors on the part of students. But we need to also recognize that the workforce, the teachers, too have experienced trauma. So sometimes we have this high level of expectation for the way adults in our system are to interact with the children, sometimes not recognizing that they too need support and assistance, that they too are dealing with depression and anxiety because they went through a trauma themselves. But the manifestation is different. In fact, the younger students are more vulnerable to the impacts of social isolation, more vulnerable to variances in terms of routine at home, to stressors in the community, because they're not able yet to decode their cognitive ability to make sense sometimes of the nonsensical is somewhat limited, right? In addition to that, regardless of the age grouping of children in our systems, there is a disproportionate impact specific to trauma, specific to depression, specific to societal issues on communities and children in communities who are in a fragile condition to begin with. So students in poverty, Black and brown kids, children who are English language learners, students with disabilities, students who are in a foster care system, unhoused students, or students who may face food or house insecurities. And the impact in terms of mental well-being, in terms of social emotional stability, further deteriorates for those fragile communities of students, regardless of age. With that said, during those transitional periods, certainly in middle school age students who historically have dealt with that surging of an emotional stage that we all recall well as parents, right? They have a difficult time dealing with these issues. And look, we can spend a lot of time describing the conditions, but there's also hope, right? We are at a point in time now where the resources to address these issues exist. The key is, after all this federal funding that's right now bathing around our system disappears, will we actually remain committed in making the necessary investments, and with the deployment of psychiatric social workers and school psychologists and the action of social agencies that partner with the system, in the absence of the billions of dollars of federal funding to address, in large part, these very, very important issues. As a nation, as a state, we need continuity of awareness, continuity of funding to address particularly the most disproportionately impacted communities on the issue of mental health and social and emotional support.
So you started by talking about the role of teachers, educators, the adults in our system. Would you say that that's the top priority that we should be focused on as we think about addressing the mental health and well-being of California's youth? Is it really mostly about taking care of those adults who can then take care of our students?
A good question. No, I think it's not an either or proposition. It's a both and. It's absolutely primarily focusing our attention on the mental health, well-being, social, emotional support for our students, beginning on a priority basis with those communities, those schools, those populations who disproportionately have experienced trauma even prior to. Trauma has deepened into a darker space than ever before, because it is the sad beneficiary of the compound effects of multifaceted trauma, stress, pain, depression, alongside all of the gaps that these students face. With that said, I think there is enough space and bandwidth and resources to simultaneously address the needs of those who care for children, because they too have been victims of trauma and stress. I mean, I've spoken with literally hundreds of teachers who during the pandemic, teaching online, were conveying to me how depressed, how sad they felt. Particularly think about this, teachers of students with disabilities who were doing their very best. And doing their very best, they were lamenting the fact that they felt they could not connect at the level that they needed to connect with the children they knew so well, because the physical interaction, the ability to touch, the ability to hug, the ability to express in a very visible, present way, the love, the empathy, the understanding, the support that cannot be replaced through any type of technology. So it's not an either or, it's a both and.
Great. Melissa, what would you identify as kind of the top priority that we should be paying attention to in supporting the mental health and well-being of California's youth?
I think this is one of the hardest questions, because we really have to be able to walk and chew gum right now. We have to be able to focus on some of the immediate needs and what we are seeing in terms of support for children and youth. And I absolutely think for the adults around them, we know that supporting the adults around our children and youth matters. That makes a difference in terms of their well-being. But we also know that these long-term challenges, and we have heard this from our partners and stakeholders on the work we're doing with the state's Children and Youth Behavioral Health Initiative, unfortunately, there are not a lot of easy, quick fixes. These issues are long-term, and some of the ways we are seeing to address them, we are seeing paths forward for that work, but some of it is mid and longer term work that will be challenging and requires us to actually make changes to the systems we have that support social and emotional well-being, because We have to remember that it's the systems we have today that are producing the results and the inequitable outcomes that we are getting today. So we're going to have to make some fundamental and foundational changes to those systems. And that is longer term work. And so I think, as the superintendent indicated, we have to take an and approach. We have to figure out what can we be doing now. For example, the governor had several proposals in the May revise of the budget to really focus on some of the immediate needs and crisis facing our children and youth and their social and emotional well-being. And we need to simultaneously continue the mid and longer term work of the Children and Youth Behavioral Health Initiative to really think about putting in place the infrastructure, the systems that we need that support social and emotional well-being. And I want to really emphasize a point that Lishaun made earlier, which is around really thinking about across these systems, how we embed prevention and early intervention, really across the entirety of the age span, and across the entirety of our systems that, yes, of course, we need to do a better job providing coordinated, integrated care for our children and youth who have more complex and intense needs. But we've also heard from so many partners and stakeholders that there is a real opportunity to do more in terms of prevention, that because our systems operate in silos often, that lack of coordination and integration can get in the way of opportunities for prevention, early intervention. And so really shifting our work to a focus on prevention and wellness for our children and youth is key to our work ahead.
So Lishaun, I want to follow up on that. Superintendent Carvalho mentioned the fact that, the mental health crisis that we're facing with youth right now really disproportionately falls on low-income communities and communities of color. We've talked about prevention as one of the key strategies that we need to adopt in order to address some of these issues. Can you talk about how equity can serve as an organizing principle across this youth mental health crisis when we think about how we address the issues, particularly for low-income youth and youth of color?
Yes, that's an excellent question, Lande. And I think that we need to do my favorite thing, which is looking at the data, right? And so we have so much data that tells us who our kids are, where they live, what they look like, and what they're going through. But we're not creating solutions that are unique to those populations. So what I mean by that is, we know that if you are working with, let's say, the African-American community, the Black community, there are going to be specific interventions that the Black community is going to receive and that they are going to be open to in order to have an impact on that group. Same for our Latino community, same for our API community, same for our Native American community. So we need to really think about our solutions and in terms of subpopulations. It's one of the things that I was happy to see in the May revision with some of the governor's proposals around suicidality and being specific to subpopulations. Because while Melissa did note that between 10 to 18-year-olds, 20% suicidality has gone up between 10 and 18-year-olds in California. For African-American youth, it was actually 28%. So our subpopulations need specific plans, and we need to be thinking about them strategically on how to have the best impact and the most impact.
Excellent. So Superintendent Carvalho, can you talk a little bit about how you've adopted a much more sensitive approach in terms of subpopulations within LAUSD? What kinds of things are you doing, for the Latino community, for African Americans, for Asian Americans, for Native students? Are you able to distinguish or discern or adopt those kinds of strategies by population?
Well, to Lishaun's point, which I agree wholeheartedly with, we need a differentiated approach that targets different communities. If we take a one-size-fits-all, it is a guarantee that we will lose all. So we know that. So I've only been here a couple of months, right? Part of my listen and learn tour and part of my 100-day plan actually addresses that. Is I don't have the answer, but a lot of these answers actually reside with community agencies that are closer and embedded in the communities they serve, rather than outside external entities and agencies trying to bring about change without the trust factor. And I want to speak a little bit about the trust factor, right? Certain of our communities are distrusting of that one entity who may not necessarily represent, connect, understand the culture, the tradition, have the lived experience, coming in and bringing a solution that is off the shelf. These communities don't want off the shelf solutions. They want organic solutions that are born of and flourish from the community itself. So the solution for us, which is going to be implemented very soon, is a reliance on agencies that were created within the community, understand the community, rely on talent from the community, with partnerships with organizations that are supportive of the community. And I think that is exactly what Lishaun was talking about. So in a practical way, it is absolutely contracting with, partnering with agencies, not-for-profits, community entities that are from the community, understand with the appropriate professional support from the district in terms of making connections. This cannot be a crusader's journey. It cannot be a savior's journey. It's one of realizing and recognizing that community solutions born out of the community itself with the appropriate resource investment work best for those individual communities.
What I hear you saying is the responsibility for addressing mental health falls on a number of institutions, falls on our community institutions, our schools, falls on government. Lishaun, Children Now just gave the state a D+ in your report card, right? Noting that the state was falling short in terms of providing necessary services and supports. Talk about the ways that you think the state, as one of those entities that bears some responsibility, can improve upon its standing. And then I'm going to let Melissa respond to that since she's with the state, and we'll talk a little bit about the Children and Youth Behavioral Health Initiative. But tell us about the D+ and what that meant and where you think we're going.
Yes. So for those who don't know, Children Now comes out with a report card every 2 years, grading the state on a variety of issues, one of which is mental health and substance abuse. And the D+ really was about two main things. One, the state has the power and the resources to kind of set the tone for expectation of what our schools, communities, districts, community-based organizations are going to be doing in order to impact mental health. And we feel as if they haven't quite set that tone as yet. They haven't quite set those expectations. So what I mean by that is it would be great if the state said, hey, we want to deploy funds and resources to ensure that we are addressing this specific subpopulation, and we want districts to focus on this subpopulation to get the suicidality down, to increase the rate of attendance, to do whatever, right? So we wanted that level of expectation. The second thing really is about making sure that they remove barriers for families to access mental health services, right? So what barriers currently exist? We know that workforce is a problem. We know that commercial health plans might not be doing as much as they could be doing when it comes to providing mental health services, right? And there's this false dichotomy or false language about Medi-Cal versus managed care. And the reality is, I've heard parents tell me, I quit my job so that we could get on Medi-Cal so I could get mental health services for my kid. That is a problem. That is not where we want to be. So there seems to be a hyper focus on what's going on with county mental health, as there should be. I understand that's state dollars. And we haven't spent as much time thinking through what's happening with commercial insurance and how that actually impacts our public system and how that actually creates stress on our public system, right? So if everything were working well here, we would actually have better outcomes and the ability and more money to do something on the public system side as well. So that is a very short way of saying, setting expectations for communities to follow through on, and holding systems accountable, holding commercial plans accountable, holding counties accountable for the things that they are supposed to be doing already.
So it sounds like the D+ is in part on the state and in part because we have commercial insurance, as you say, that doesn't actually support the entire system the way in which it needs to. I want to pivot for a moment and talk about the Children's Youth and Behavioral Health Initiative. This was a $4.4 billion investment by the state last year to develop a comprehensive system of mental health for the state of California from birth to age 25. I think that's really significant because when we think about youth, we oftentimes think about maybe adolescents or maybe young school-age children, but we're really talking about birth to 25. Melissa, can you talk about the goals here? Can you talk about what you think are maybe some early signs of progress and how all of that really has to do with this infrastructure, this ecosystem that is responsible for responding to the mental health crisis that we're facing?
Yeah, thanks, Lande. And the one thing I just want to note from the prior conversation briefly is we haven't spent a lot of time today talking about our LGBTQ plus youth, but I think as we are highlighting the importance of focusing on populations that we know are disproportionately impacted by mental health needs, I think it's just really important that we lift up our LGBTQ plus youth and focus on that.
Thank you.
So yes, as Lande said, the Children and Youth Behavioral Health Initiative was created in last year's budget, and it really is meant to help us come together and reimagine the ecosystem that supports social and emotional well-being for children and youth ages 0 to 25. It is for all children and youth 0 to 25, and it takes a targeted universalism approach that says we have this goals of well-being for all our children and youth, but we know that there are groups who are disproportionately impacted, and we need to have targeted strategies and approaches to address that. So for example, one component of the Children and Youth Behavioral Health Initiative is scaling both evidence-based and community-defined practices. And we know that some of those community-defined practices, as the superintendent was describing, are deeply rooted through trusted community-based organizations that have practices and approaches that are deeply impactful. And how do we lift those up and think about the scale and how those are supported? I think the other piece of all that's really important about all children and youth is a key feature of the initiative that addresses that is it includes a statewide fee schedule for school-linked behavioral health services. So I know that can sound very bureaucratic and people think, well, what does that mean? Why is that going to make a difference? And that's because today a number of behavioral health services, range of behavioral health services are provided in school-based, school-linked settings. And so we don't necessarily have the infrastructure we need to support financially the ongoing support and sustainability of those systems. This new fee schedule will apply, as Lishaun was noting, it applies to both Medi-Cal managed care plans and commercial plans. So that will mean that students who receive certain behavioral health services that are in the fee schedule, that there will be an opportunity for there to be payment for those, which we really think is critical to improving access to needed behavioral health services, as well as supporting the robustness and sustainability of those services ongoing. But the initiative really does seek to address the infrastructure issues. We've talked about some of them today. Workforce, incredibly important. We know we do not have a sufficient behavioral health workforce overall, including for children and youth. So we are working to make substantial investments in the workforce. I think you asked Lande about sort of like, what are some early signs of progress? And I will tell you, one of the most important ones that has come up is our systems are very siloed. And we simply have to have greater partnerships and collaboration across different parts of the health and social services system and education, early education, K through 12, and higher education. But I would say one of the early signs of progress is how shared that desire and vision and commitment is to building those partnerships, to working on those collaborations, to taking bright spots where that's already happening in local communities. And part of our work of the Children and Youth Behavioral Health Initiative is figuring out how do we scale and sustain those bright spots? But that commitment to partnership and to actually rethinking how we do some of the things we do today to create a more equitable, coordinated ecosystem that supports social emotional well-being, and then that we have a way to help support the sustainability of that is really, really critical. And I think that the energy and the commitment from partners and stakeholders, I want to say youth themselves, a really important part of the Children and Youth Behavioral Health Initiative is the engagement of youth and families in the work itself, in the process of planning, in the process of design, in the process of implementation. I think that is sort of one of the secret sauce aspects of this initiative, which is making sure that that youth and parent, not only voice, but experience and sense of priorities and what works is part of the work of the initiative.
Great, thank you. We are going to pivot in just a few minutes to our question and answer with the audience. As a reminder for our audience, if you have questions, please submit them to PPIC eventquestions@gmail.com, and we'll make sure to get those questions over to our panelists. The final question I'd like to kind of ask of each of you for maybe 30 seconds each is, as you think about this coming year, the governor and the legislature are working right now to finalize a budget. Could you each talk about maybe one investment that you see coming out of this budget that can really be game changing in terms of youth mental health? And let's start with you, Lishaun.
So I think the governor's May revision outlines, I believe it was $290 million to address the current crisis related to suicidality and prevention. And I think if that is done quickly and that is done well, it could be game changing. I think we would also like to see money dedicated specifically for infants and toddler mental health, because we know that that is so important and that they are also struggling in the moment, and parents or caregivers are struggling in the moment. That's what I would say. That would be my 2-second round out on what could be most impactful in the governor's budget this year.
Great. Suicidality and youth and toddler, infant and toddler. Great. Superintendent Carvalho, what's your call out for the governor's budget?
So I was actually going to be right in line parallel with Lishaun's comment, but since she mentioned that, I think we're facing a critical shortage in terms of mental health workforce. And there is a current bill that would provide stimulus and funding to address mental health workforce through a grant program. Critically important. I'll just reflect on LA's reality. We budgeted last year, actually prior to my arrival, for 900 new psychiatric social workers. And California, I believe, does not produce that number of individuals with that specific talent, right? And credentialing every year. So there's a critical need to stimulate workforce development and preparation in this key area. And I think it's actually Senate Bill 1229, which is supported by State Superintendent Tony Thurmond, that would appropriate that level of funding to generate, to support the workforce that we need.
Great. And Melissa, I know you're already trying to manage $4.4 billion, but is there one thing that's coming out of this budget that you're looking forward to that can help to augment or amplify the work that you're already planning?
I'll lift up 2 things very briefly. One is, I think the governor's May revise really continues to take a holistic approach to mental health for our children and youth and families, really thinking about the social determinants of health. And I think it's critically important that we continue to advance that approach with our partners and policies. And then secondly, within the $290 million that Lishaun mentioned that are proposed additional investments in the May revise, I want to lift up one piece around of that was really intended to take some of the lessons from COVID and think about how we think about youth mental health, particularly youth suicide, from a public health approach. And how do we really bring the tools? So one of the sub proposals there is to make youth suicide and youth suicide attempts a public health reportable event that would then trigger a series of crisis response and supports, hopefully also to support the children and family and youth around those individuals and their well-being during a really difficult time. And I think, sort of going back to your very original question, Lande, taking insights and lessons from this experience and applying them to the well-being of our youth, we're hoping to be able to move forward with that pilot to do that.
Excellent. So let's go to our audience questions. The first one comes from Mark, who was with Kaiser Permanente, and he writes, "We keep using the word crisis for youth mental health, but not acting like it's really a crisis. We act much more like it's a stubborn policy issue. So the question is, if we treated this like a crisis, like the COVID-19 crisis, for example, and wanted to take immediate actions through executive orders, legislation, or significant new spending, what would you prioritize?" Anyone?
So I think Mark has been reading my emails. I can't prove it, but it does feel that he's been reading my emails. So I'll just note that at Children Now, we actually did write a letter to the governor with some partners asking for him to declare youth mental health as a statewide emergency, precisely because of Mark's comments that we're not acting as if it is a crisis. And part of it wasn't just to make a simple declaration and move on, but so that we can trigger the things that would say that it was an emergency, right? So that we can act kind of like what we did with COVID. We moved so fast with COVID. And now I tell people all the time that I am no longer of the camp that believes that government is slow and can't do things quickly, because I saw that was not true with COVID. The government can act quickly if there is enough incentive to, and we saw that with the crisis. So I would say, right now with the governor's May revision proposal and the $290 million that's in it, that suicidality plan is a solid plan, right? But we need to move very quickly with it. It can't be filled with red tape. Dollars have to go and flow to communities faster than it's ever been, just as fast as we did with COVID, right? So some of that is going to be an implementation issue. So I do think that if we treated this like a crisis, our implementation timeline would be moved up drastically.
That's great. Question 2 from Adam Bowman, who is in Assemblymember Vopel's office. I want to ask about the funding going towards after-school programs, in particular elementary schools, because during the school day, a lot of learning is based on teacher-to-student connection. In contrast, after-school programs focus much more on team-based approaches. Would more after-school programs help with the social isolation that we see? And would this give youth less time to access social media that seems to be keeping them engaged? Maybe Superintendent Carvalho?
I'll take a stab at it. And number one, let me just say amen to what Lishaun just stated. So again, it's not an either or. We need full funding on a recurring basis to support staffs and programs. They are indispensable to bell, offering of services. We're talking about, reducing the counselor to student ratio, increasing the number of social workers and psychiatric social workers, providing better connections with the appropriate funding between what happens in a schoolhouse and is identified or detected in school in terms of specific behaviors manifested by students, and community organizations and agencies that can, in a holistic way, address those issues with the student and the family or the guardian. At the same time, yes, to the specific question, yes, after school programming needs to be expanded. We need to have a universal solution that provides every single family, every single student with a high quality after school program that reflects both academic needs, solutions, acceleration, but also social and emotional support. But I'll go beyond that. Some students depend on that bus ride to get home, so they cannot stay after school. So we need to be creative and find more flexible ways of delivering the same level of support. Saturdays is a good idea. Diversifying the delivery system by not having it necessarily tied to the school. Summer programs to reflect also the provision of those indispensable services to students. So the more we diversify and the more we make these systems flexible by following the needs and the conditions of families and students, the more success we will have at actually making meaningful connections with the students who currently are exhibiting this evidence of trauma and stress.
Great. A viewer in San Francisco. Oh,
Lande, I just wanted to add, I think that the superintendent's point around this is a place to really be creative and innovative is incredibly important. So for example, one of the things we're working on in the Children and Youth Behavioral Health Initiative is thinking about, given some of the additional funds for extended learning after school and in summer school, what are the opportunities to link efforts around supporting behavioral health of students in those settings with those opportunities? Like, how do we bring those efforts together for the well-being of children rather than sort of keeping them each just in their own lanes? And I think that is the kind of creativity and innovation that we really need to tackle.
Great. Always trying to silo bust. A viewer in San Francisco writes, the LA Times a few days ago had an article about secondary or collective trauma resulting from the recent mass shootings, especially when the victims come from someone's own community or background. In your respective roles, could you each take a minute to say how you're thinking about how California's youth are responding to these tragic recent events?
I think I'll go first this time. I mean, within the spectrum of adverse childhood experiences, certainly the fear, the stress, the trauma impacting kids as they view, hear, attempt to decode, make sense of the senseless gun violence, and in particular, the inaction of the protective adults to this national crisis. I think kids are paying attention to that. So they are impacted on one hand by the direct stress, which is the visuals, the optics, the assault on their consciousness specific to gun violence and the victims of all ages. But I think there's also a stress, doubt, confusion over the fact that students are looking to adults with some degree of power, and they're measuring and attempting to analyze why the inaction. All they keep hearing is the crisis specific to gun violence, the impacts, but they don't see actions, viable actions. They see inaction. And I think that is terribly distressing to young people. Look, just yesterday here in LA, we had hundreds of students express in a very vocal way the way they feel. And that was the number one issue. We are hurting. We are in pain. What are you doing about it? What are you doing about it? And this is one of those where, yes, mental health support is important, but a decrease of the metal in our streets is also important. And there's no level of mental health service that is going to remove these weapons of war from our streets or from the hands of individuals who should have no access to anything like that.
Lande, can I add something as well really quickly? And I really want to, credit the question with the term collective trauma, because I do think that as a society, it's not just a California problem. We've done a really poor job with our ability to address collective trauma, group trauma. We see that with mass shootings, right? The students of Columbine now have children and are going through this all over again. But we also see this with, communities. Black communities have had a collective trauma when it comes to aggressive policing. We know that young adolescent Black males suffer from PTSD at much higher rates than any other group viewed aggressive policing. We know that after the George Floyd event, Black people reported a hit to their mental health at much higher rates than any other racial group, right? So now you have mass shootings and everyone is on edge as well. We don't do a good job when it comes to addressing group trauma. And this is where I say part of the problem with how we have approached mental health is we haven't been honest about what is state-sanctioned violence and how it is impacting youth mental health. The things that we aren't removing from children's lives that are harmful to them makes us just as culpable, right? So Superintendent Carvalho talked about, we're not removing guns from the streets, right? And that makes us culpable. We're not removing aggressive policing, and that makes us culpable. We're not removing the things that are impacting the mental health and well-being of children. We're simply trying to band-aid a lot of these issues and provide help after the fact. But there is no full mental health system if we're not also removing the things that are horrific and frankly state sanctioned for our children.
Thank you, Lishaun. I know we are getting very close to our time, the end of time. And so I wanted to end with one last question. And it might seem odd in light of the conversation that we're having, but I'm wondering, as you all think about the future, as you all think about our youth, as you all think about our healthcare providers, our teachers, our institutions, what gives you hope? What gives you hope that we're going to round the corner, that we're going to be able to respond to this crisis as a crisis, that we're going to actually meet the healthcare, the mental health care needs of our youth? And let's start with you, Melissa.
Well, a number of things give me hope, and I would highlight right now two of them. So one is there are many folks who are dedicated to this work, whether they are teachers, healthcare providers, others, to the well-being of children and youth. And I have had so many conversations with partners and stakeholders who have said, we're ready to roll up our sleeves and take on the hard work of doing things differently so we can get a different outcome. And that gives me hope, because this is hard work. The changes we need to make are challenging, and we are all going to have to roll up our sleeves and really dig in and do significant change work together. The second thing that gives me hope is, as I mentioned earlier, I've had the opportunity to speak to a number of youth and parents, and youth are incredibly knowledgeable about their own mental health and well-being. They are in conversation with their peers. They are advocates. They are leaders. Their participation in this work and the centering of their experience as part of it gives me hope about the work that we can do together ahead.
Great. Superintendent Carvalho, what gives you hope?
Look, I'm in a business of hope. I'm an educator, so I see it every day. I hear it every day. And the younger they are, the more hopeful they are, right? But look, I think there are some very, very strong hopeful signs before us. Number one, a level of awareness that's unprecedented in our country, in our community, specific to mental well-being and social emotional needs of students. There are also signs of strong hope specific to the progressive destigmatization specific to certain communities where mental health is now being discussed without the frown or that odd look. Or thirdly, I am really very hopeful about the continuity and increased funding to address in a strategic way the needs of our communities. Investments, the likes of which we would not even have imagined. Forget about 10 years ago, 5 years ago, 3 years ago. Now there's awareness, there's a degree of impatience, do more in a strategic way, and there is growing resource investment as part of the solution. With that said, we're still in a crisis, and we still lack solutions for that crisis. So that impatience needs to continue to grow, the advocacy, the demand needs to continue to grow, and this cannot be a discussion or pieces of legislation that basically fund for-profit entities that benefit from the crisis itself. Needs to be an investment that permeates through the community in a way that the community trusts and believes in.
Thank you. And Lishaun, last word, what gives you hope? From D+ to hope, what gives you hope?
Young people give me hope. I have no doubt that if young people were running things would be much better. They are not afraid to talk about mental health. They are not afraid to talk about addiction in a way that just wasn't true when I was growing up. So that is really hopeful to me. When people talk about stigma, I note that you're probably talking about the adults who still have stigma. You're probably not talking about the young people. So that gives me a lot of hope, because I think that's going to be a generational change.
Excellent, thank you. I know we are 1 minute past our time. I just need to stop and say thank you to each of you for the generosity of your time today, for joining us, for helping Californians across the state better understand this issue. Thank you so much for joining me today.
Thank you.
I also want to thank our sponsors again, and I would like to say to our audience, please note that if you pre-registered for today's event, later today you'll receive a survey, and we hope you'll take some time to fill it out and tell us how you think this program went. And finally, I want to thank each and every one of you who did spend some time with us today. The issues related to student mental health are serious for our children and for our communities and for our nation. If you need more information on how to address mental health challenges for a young person, for your school, or for someone or your entire community, please visit the state's website at www.chhs.ca.gov/children's-mental-health-resources. Thank you for joining us.